Hello everyone, welcome to my PowerPoint presentation on CPAP. So it means continuous positive airway pressure. Now what this CPAP is, this actually a machine that blows air through a tube with a pressure regulator. This device makes it easier for the people who are diagnosed with certain respiratory diseases, especially with sleep apnea syndrome. Now, what exactly this sleep apnea is? This is a sleep disorder in which breathing repeatedly stops and stirs. If people snore loudly and feel tired even after a full night's sleep, so uh, people may have sleep apnea. So there are mainly two types of sleep apnea: obstructive sleep apnea and central sleep apnea. OSA or obstructive sleep apnea, this is a more common form that occurs when throat muscle relax and block the flow of air into the lungs. And central sleep apnea, it occurs when the brain does not send proper signals to the muscles that control breathing. So as we know, we have a mask, CPAP mask, and it's connected through a tube into the device. So your doctor will suggest which mask you need according to your diagnosis. Especially there is three types of the CPAP mask: nasal mask, full face mask, and nasal pillow. This nasal mask we see in the first picture. Nasal mask. It covers the nose and is held in place with straps. It is the most common type of CPAP mask. And the second one is full face mask. This mask usually cover nose and mouth, though it might sit under your nose and cover your mouth. It's held in place with straps. This mask type may be beneficial for the people who have air leakage when using nasal mask. And number third is nasal pillow. This nasal pillow mask consists of soft silicone tubes that fit directly into your nostrils. You might prefer this style if you experience air leaking with other types of the mask, or if you don't like anything covering your nose and mouth. And your doctor will suggest appropriate device and the mask, because this machine, it has specific air pressure, and especially with the mild sleep apnea people, they need lower pressure, lower amount of airflow pressure. And we know this pressure is higher than the outside, outside the device. Pressure is higher inside the machine. So your doctor will suggest it is not possible to manually. Now, how to use this machine actually? This CPAP treatment is given at night while you sleep. You wear a mask over your nose that is connected to the machine by a tube. This machine itself is located next to your bed. The air that you breathe in through the mask has a higher pressure than the rest of the room. The air is blown in when you breathe in, and when you breathe out, you have to use your breathing muscles to work against the increased air pressure. This helps to keep your upper airways open and prevents them from collapsing while you sleep. This is important that you use this machine every single night and don't take it off during the night. Using this right mask is crucial for successful CPAP treatment. You need a mask that is comfortable and fits tightly against your face so that air does not leak out of the mask, as this is both uncomfortable and makes the treatment less effective. Why people use this CPAP machine? This machine can be used while sleeping to prevent snoring and breathing stops during sleep. CPAP can be tried by people who have moderate or sleep apnea syndrome, which is a periodic blockage of the airways and reduced sleep quality. The treatment improves nighttime sleep and makes you more alert during the day. You snore less also. The risk of developing cardiovascular disease and heart rhythm disorders is reduced. Most people with sleep apnea syndrome benefit from CPAP. The method is also recommended for people who are severely overweight and have cardiovascular disease. There can be some side effects using CPAP machine also. The common side effects are dryness of the nose, throat, and lips are common. There is an increased tendency of congestion, inflammation, and infections of the nose, throat, and sinuses. Some people have an increased tendency for nose bleeding also. Irritation of the eyes and facial skin may occur. To prevent this kind of side effects, people can use humidifier at the room to moisture the air. Can be used some mask liners or barrier creams for the sensitive skin. Or the most important is ensure your machine's setting and pressure are adjusted appropriately for you by your doctor to prevent air swallowing and discomfort also. Thank you for being with me.